as they're getting out of our facility and things like that. And so it really puts us in a situation where we don't have that supervisor being able to be mobile to supervise the rest of the facility. And so that's another issue that we were experiencing. And in addition to that, I'm just going to really quickly mention right now at this point that we not only does it pull that staff away, but we've been short at the jail, as you can imagine, with the COVID stuff right now. We have a number of our employees that are quarantined at home because they've, through secondary exposures, and so we're waiting to get test results back on them. And we have some of our staff out at the jail this month. We have one person that worked up to 320 hours in a pay period when the normal hours are 160. And we had about an additional 8 other individuals who worked 240 hours plus. And when we have to call in people to help do this med passing, and it's tough to get them to come in because we're already short because of the quarantine, and so it's putting a lot of strain. In fact, I'm worried that some of those people might leave because they're not getting any days off. So we have that, and then we have the other issue that the shortage is causing us with the medical staff is that it's the time that it takes to see new inmates as they're brought into the facility. Of course, we want to see them as soon as we can so we can see if they have any medical issues, concerns, if they need any. Our nursing staff needs to start ordering medications for them while they're in our custody. And so because of the shortage in the medical services that we've had, some of those inmates aren't being seen right away when they get into our facility, and there's a period of time that's that goes by before they're being seen. Lack of mental health care from that medical service because of the fact that we can only have the doctor come in because they're not available to us all the time. They're coming in less and less frequently to diagnose our mental health issues that we have, and working with our mental health coordinator out there to get proper diagnosis so that we know how to handle that individual going forward while they're in our custody. So those are some of the reasons, I guess, so to speak, that we would be looking to increase our service. Would we still need this if we were not in the pandemic? I would say yes. And speaking with Andy, who's boots on the ground out there, who's got better experience with me and observes these things every day and how certain situations are being handled out there medically. We were needing some additional resources before the pandemic hit, but the pandemic has just exposed more of the problems that we're having now because of the attention that some of the nurses have to pay towards some other things dealing with COVID-19. How many nurses would we need? Certainly that comes to question, and definitely what we have right now and not being able to backfill those positions, we feel like we were short already, even if we were full staff. So adding a couple for sure would be ideal, 2 to 3. And when we talk to Cass Public Health and ask them if that would be something that they could provide in addition to what we have right now, they've told us, and I can, Robert, if you want to jump in here after I mention this, they've told us that they don't have the resources to provide us anymore. They've told us that this thing didn't start out the way that this initially started out with them being contracted. The vision wasn't seen far enough into the future to look at what we currently need now. That this thing has grown bigger than what they can accommodate. In fact, they mentioned that they are short-staffed, and that typically, as most of you could imagine, most people don't want to go into the nursing field and work in a correctional facility because it's a hard job and the hours aren't always the greatest. And for lack of better terms, they get a lot of questions from inmates, and it's a tough clientele to work with. So people don't typically go into that. So they said they're short themselves, and they didn't feel like they could fulfill our needs. So that kind of answers some of those questions. Did you want to add anything to that, Robert, as far as what Cass Public Health said they could do in addition to what we have?
Sheriff, the only thing I would add on to that conversation is just backing up and really how we got into that conversation with Cass Public Health is that I initially reached out to him, and then you and I together spoke with him a month or so ago, and that was really on the specific question of needing to fill some shifts, where a combination of a position being open and then looking at a individual going on military leave as of the first of the year, and so it was really a kind of a narrow initial conversation that how do we get these shifts filled so we can relieve some of the pressures and stresses that you just mentioned, and that's when they came back to us and said, look, we're at our max, and if you need anything more, fundamentally, we need to go in a different direction, and so I think, admittedly, that kind of put us back on our heels a little bit. That was not the response that we, at least for myself, not what I anticipated. But that's really what led to some of these other discussions, because it was a narrow question to them initially that what can we do to fill these some of these open positions, and they said, we are at the limit and beyond what we really envisioned this being initially. I guess that's what I would add on that one.
Okay. So thank you, Robert, and to continue on here with a couple of the other, answering just a few of the other questions. So then some of the things that Robert and Andy and Mary and I looked at were, currently what are we paying right now for our medical services, because obviously us looking, just hypothetically looking at maybe at doing something else, if it were to go down that road, obviously we all want to know what would be that coverage and what would be the cost difference. So in our 2021 budget going forward, we, there's 616,560 allotted for salaries, those nursing salaries for Cass Public Health. And then medical expenses, and that's going to be things that we, taking people to Sanford and covering those medical costs and things like that, X-rays and stuff like that. That is 450,000. So, you're looking at just a little bit over $1.5 million for the current medical services that we have budgeted. That was approved for next year's budget, and so. We really sat down and looked and thought to ourselves what could potentially be some other options. I mean, obviously, we're not going to do this thing overnight, but looking forward, what would be some options if Fargo Cass Public Health can't provide our growing medical needs that we would need? What else could we do? And so we talked about potentially, keeping Fargo Cass Public Health, and then maybe looking at trying to add another service in addition to what they have, but we don't see that would probably be very efficient and effective based on the fact that they would have to share medical records and you're working with two different entities, and it might be more confusing, so that might not be the best option. The other one we talked about this morning, Robert and Andy and I, were can we throw Cass Public Health an incentive and say, hey, how about if you advertise to hire some nurses specifically for the jail, but they still work under Cass Public Health, but we offer them more money, and that the county would potentially pay more money? Would that be an option? Well, that could potentially be an option. Like Robert said, we'd maybe have to throw a $5 more an hour than what a nurse is typically making to even draw them over to the jail because of the environment that they'd be working in. And then if we did that, how close would these new nurses being brought on, would their pay be to the nurses that are already there, and would that cause distension between a new nurse coming on and they're already making this much money and the ones that are already working there? So that could potentially cause some problems. So we kind of visited about that a little bit, and then Robert did a lot of research on what maybe some other entities are doing, and the same with Andy, what some of the other entities are using for services, such as Clay County, Burley County, and Minnehaha County, and a majority of them are using private medical services. But of course, as all of you guys know, that's going to be more expensive than what we're using now. And in general, because we haven't got estimates back, I put out an estimate to MendCare, which is a private company, just in general, to ask them what they thought in general it would cost to provide medical services to us. And they haven't gotten back to me yet. I called them at the middle of the week last week, and they obviously they haven't gotten back to me yet with that price. But we're thinking in our minds, at least Andy, Robert, and I, that right now we're currently paying that $1.5 million with what we're doing right now, and we're thinking that we'd probably have to add on another $1 million if we brought in a private. And that's just a rough estimate. That's nothing in writing, but that's just kind of what we're thinking in our mind. It would cost us additionally to go to a private healthcare that would provide all those services, and we no longer worried about it. So obviously that's a substantial cost increase. And so we've got, I guess at this point, I would ask for some additional input from Robert and Andy and the things that I mentioned, because I may have missed a few things. And then I think from there we could maybe all discuss on, what you guys are thinking going forward and what we should try to do, and if we should do some additional informal, maybe get some informal direction from you guys to maybe continue with some RFPs to maybe get some potential estimates and things like that. So I guess at this point, I'll turn it over to you, Robert, to see if you have anything additional, and then we'll turn it over to Andy. And then maybe just all of us can start a discussion.
Sure, and thank you, Sheriff. And I'm going to be real brief, because I think what we really need here is the back and forth and the dialogue, and we need to hear from commissioners of what you're thinking, and really pose the challenging questions to us. I would just say that I did reach out to some of my former colleagues down in Minnehaha County. They have a history of using a contract medical provider for jail medical care. They've had, I want to say, 3 different providers over about the past dozen years. They have just completed going through an RFP process, and will have a new provider starting the first of the year. One of their biggest struggles that we know very well is staffing, and having the medical staff available to cover needed shifts. One of the first comments I heard from their warden down there is the need for 24/7 nursing coverage, because that just allows for earlier, even not even a full diagnosis, but understanding sort of the scope of need, and what could be done potentially in-house, what needs to be potentially in an emergency room, and then just the benefit that having that 24/7 coverage at a jail facility brings, because you're not having to run nearly as many inmates to an ER, to a clinic, pulling 2 COs out of the facility, and then you've got to juggle to meet staff minimums and get everything else covered. So I could certainly talk at greater length on my conversation, but again, I think we need to get to the interaction on this. So I'm going to wrap up my comments with those right there.
Thank you, Robert. Andy, did you want to add some things in real quick before we start the discussion, the back and forth discussion?
I'll just take about 60 seconds here. I don't know if my mic's working good. I was having some trouble earlier. We have put together all the stats for all the different types of services and everything for the last 2 years, I believe, at least for sure for this year. So we have all that if you have any questions there. Just one point of clarification, the total budget for 2020 medical services was $1,050,000, not 1.5. It was $599 for salaries and benefits for the nurses, and $450 for the outside medical care that we can't provide in-house.
Yep, that was for, and I was mentioning 21, Andy, but yes, thank you.
So with that, I guess questions.
Okay, Commissioner Pollack, it looks like you had your hand up.
Yes, so I think we need to look at this in the cost per inmate. if we're going to be comparing what other organizations are doing, we have to look at it on a cost per inmate. I don't think it really works to look at it on a cost per nurse. And have you considered that at all?
I'll be honest with you, Commissioner Pollock, I have not. I hadn't heard that from Andy or Robert, but maybe they have. I would welcome any comment that they had, but we hadn't done that. It's a good point, though.
Okay.
The last assessment I did on that, it's admittedly been about a year since I did that. It worked out to about $750 per day per inmate is what we spend on medical services.
Okay. I just don't think that it's really going to be fruitful to depend on Fargo-Cass Public Health going forward. although what I would like to see is I would like to see them help do the screening and the hiring, or maybe not the hiring, but the screening and the interviewing for the nurses that you need. And I think that the way that has to be looked at is, first you have to look at what you feel that you need. If you need to have 1 or 2 full-time people at all hours, or maybe you need 1 around the clock and then you need a second one during the day. I mean, you have to figure that out. And whatever that is, I mean, that should be the baseline that we start from, and then we have to figure out how much we want to pay for it. Because maybe we're not able to do that, but I think we have to look at this first on the basis of what's it going to take to accomplish what it is that we feel needs to get done.
Sure, and Commissioner Pollock, that gets to be kind of, I think, so Andy was doing a really good job putting together the RFPs and different needs that he felt that we needed. Where it got a little tricky with that piece, and I totally agree with you, was that when we were, like, for example, when I called MendCare, the private company, they looked for some specific information, and then they were going to get back to me with how many people they thought they needed to cover what we were asking for the services in there. Does that make sense? So Andy, like I said, Andy did a really good job putting together what he felt we needed in there to be covered, and then we give that to them, and then they were saying, well, you'd need to have 8 nurses or 9 nurses to complete what you were requesting.
So I don't know why if you can qualify and hire the nurses, I don't know why you need to have an outside provider to do all that, other than they're used to working with the nurses. But if we can use Cass Public Health to identify and screen the potential hires, couldn't we make that just essentially another operation of the jail?
Did Andy, were you going to comment on something? I saw you had your hand up.
Yeah, if I could address that for just a minute. One of the things that I had probably underestimated but still had observed is related to Commissioner Pollock's question there. In the sample RFP that we got that Minnehaha sent out, being close to 40 pages long, a significant portion of that relates to the administrative tasks. One of the benefits we have that keeps our costs low is that we have, by using public health, they already have all that built into their system, how they manage it, how they hire, how they do payroll, how they do all the record keeping and all their associated relationships with outside providers. Beyond just having nurses on site to provide the care, there's a whole host of other medical administration that has to take place to keep all the records and everything. And that's where that management fee comes in. That's the real nuts and bolts of actually coordinating everything, not just having the nurses here is a key point. That's what we pay for. That all that other stuff is just built into Fargo-Cass's operation right now, and we would have to replicate all of that with a new service. Just for some perspective, just alone, I spend probably close to 5 hours a week. I handle myself all of the invoicing that we get from all the outside providers, simply because the medical staff don't have enough time to do that. So I do all the sorting and confirming of all of the bills that we receive and make sure the inmates were in custody, because there's so much of it that sometimes Clay County inmates get stuck on our bill and so on. So all that has to make sure that everything gets paid. All of that would have to get transferred over to another entity as well. And that was just simply something I took on probably 4 years ago, just simply because they were falling so far behind. We had bills that weren't getting paid sometimes for 9 months. they were so far behind on keeping up with invoices.
Robert, did you have something to add?
Yeah, I wanted to follow up on Commissioner Pollack's last question or statement there of potentially bringing the nursing operation in-house if Fargo Cass Public Health were to help with the hiring and we figured out some shift differential or something to be able to staff up. Is that not living in your world and not working in that every day? Is that realistic for you as jail administration and staff to fully manage the medical end of the operation, essentially as we are now, minus Fargo Cass Public Health?
So, and Andy, you can add to this, but I'll just say real quick, I think, and Mary, you would have a good idea on this. With your experience, but I think we would need to, and I don't know how that would work, I'm just talking out loud here, but how would we, that would have to fall under a doctor, wouldn't it, to govern the nurses there? And how would we find that person if it was underneath Cass County? And I'm just throwing this out, I don't know. So.
Can't hear you, Mary.
You're muted, Mary.
I think it would probably be somewhat similar to how we've run the coroner's office for years and years in the past, you know, when we had an MD in charge of that department and then we had other staff, but it certainly would complicate things. I wonder if is there a hybrid that we could do and utilize Cass Public Health in the way we do now, and then supplement with our own staff. I mean, a lot of this has come from just passing meds. You don't need an RN to pass meds, but you do need somebody that's trained to do that. Could we hire specific correctional officers that's what they do, and they'd be part of your staff?
Well, and Andy, I'll probably look for some input from you, but I would say that I think that I'm just trying to think through that question. Obviously we would have to. I don't know that someone would leave a correctional officer position and go into that, if that's kind of what you're referring to. I guess maybe. I guess I don't know if the pay would be more. It would probably have to be more, but then would we be? How would it work with the ones that are already there, and how close in pay would they be to them? Would that cause some distension, like I kind of mentioned before? But in addition to that, I guess I don't know. I think one of the services that we were looking for also, though, was the time that it takes to see inmates, and I think that would have to be more in line with an RN as opposed to an LPN. Unless we think that would free the RNs up a little bit where they could focus on that. And that's where I would really look to Andy, I guess, for some guidance on that, since he's out there every day.
And I guess what I was referring to is just a position within the jail, you know, as a county employee that would be passing meds in the jail. I mean, whatever you think their training needs to be, obviously they would need to have that medical training, which doesn't take long to get. It's not an RN or an LPN. And what other kind of training is necessary to be in the jail? You know, I don't know. You're the expert there.
Sure. Andy, do you have some comments on that?
Sorry. I know Chad had his hand up first, so just real briefly, just to try to metaphor this for you. I know we're spending a lot of attention talking about the med pass, but you know, if you're looking at this like equivalent of trying to sell a house, if we're talking about just taking care of the med pass, that's equivalent of getting the lawn mowed. And there are much deeper issues here. That would be great to have that, and we could certainly do that just with more correctional officer staff that were dedicated to do that. That would solve the med pass problem. But I think the highlighted things that I put in the summary of everything where we're falling short, I don't know if you guys have seen that yet or not. We can certainly distribute it. Would really emphasize just how much we need that additional medical care on, you know, COVID aside.
Chad?
Thanks, Sheriff. Yeah, the problem I'm having right now is I'm uninformed, and that's my fault as much as anyone else's. I need to understand better. Maybe you said, Captain Kruvig, that you've got more data for us, more information for us, exactly what the people do. That's what I'm not understanding. If we have doctors out there and we're doing surgeries and we're cutting people open and need anesthesiologists, all stuff, that's one thing. But my understanding of this was the nurses essentially meet with someone, find out if they're sick. If they're sick, we bring them to the hospital where they can get care. We're not doing any diagnosis, correct?
Well, the nurses are obviously referring people if they need to go there, so they're kind of somewhat doing a diagnosis, but not a full doctor's diagnosis like you're saying.
Bingo. So to me, what I need to better understand is what your current staffing. Let me back up. The first thing I would do is I would go out and I would get proposals, as I think you've started, Mr. Wilson. Get proposals from a private provider, see what our baseline of that number is. That's one starting point. The second starting point is where we're at right now. So we're spending $600,000 with Fargo Cass Public Health. As Commissioner Shirley hinted at, is there a hybrid model? But to me, the way I would solve this is, if Fargo Cass Public Health isn't cooperating, let's say we have, in Captain Kruvig, how many people do we have out there right now? Nurses, is it 8? We're supposed to have. That's a fair question.
Either 7 or 8. I can't.
Okay, let's say 8. And let's figure out, it's going to cost whatever $1 million for the private provider. We're at $600,000 right now for 8 people that are periodically there and really don't seem to be accomplishing the mission. What would happen if we did this ourselves with 10? And I realize this is a learning curve. As Captain Kruvig said, that you can't go in and we've got administrative costs, we've got all these other things. So there's a little bit more, but then if we have 10 full-time employees, once we mobilize this thing, it'll be exponentially easier. The fact that Andy's going through their bills is, and I get it, you're doing it as a favor to him, Andy. I get that, much respect, but it's ridiculous. You shouldn't be doing that. You should be running the jail. So we take that off your plate. I think in the end, we get to a hybrid model. We're a little bit more than we are, and we have 10 times better service. And it's a matter of figuring out where we are, where we could be, and then finding a happy medium.
So in order to do that, if I was understanding everything correctly, Mary, from what you brought up, is obviously we'd have to find a doctor somewhere to govern those nurses, correct? And how do we do that? I'm simply asking because I don't know. Like, do we approach CAP?
I don't think you need a doctor, because how does a jail with four inmates have any? They don't have doctors. What we have is nurses that say, yep, Bob's sick, bring him to the hospital. If we're telling people what their problems are, we're taking on a massive medical liability.
Well, that's what I'm saying. I think the nurses confer with the doctor all the time at Cass Public Health on what their symptoms are, and they need the doctor to get them prescription medications. So they're continually conversing with the doctor, from what I understand, unless I'm wrong, Andy, on what the inmates' conditions are, and seeking guidance from a doctor on medications that need to be filled and writing the scripts for those and things like that. Am I wrong, Andy?
Yeah. So a couple things on that. We have a nurse practitioner that comes out here, I believe, 2 days a week to do on-site appointments that get referred from nurses, and of course that's something that's triaged based on severity of need, and often there's it could be a 3 or 4 week wait to see that doctor. The nurses out here are consulting with physicians over the phone and telemedicine and such, probably 7 days a week for various things. And then the state standards do require that we do have an appointed medical director that has to be either a licensed physician, a physician's assistant, or an RN to oversee policy and training and provisions for medical care, all within medical standards, as drafted by the Board of Medicine, and there's a whole association for correctional medicine assigned as well. So there are state standards that require us to have somebody appointed. Right now, that is Dr. Espejo out of Family Health Care, and I don't see any reason why we couldn't, contract that on our own, provide those services. Right now, we get it as part of our monthly agreement as our primary clinic provider for repurchasing something like that on our own probably wouldn't be too much of a barrier because it already exists right now. It's just that everything that FargoCast has arranged for us would have to be replicated in some sense beyond just the nurses that are here.
Okay. So I mean, I guess we would have to approach Cass Public Health then, from what I understand, and ask them if we could contract with him, particularly, if I'm gathering this all correctly. We'd have to, I'm just using this as an example, get a hold of him, ask him if we could contract with him or with Cass Public Health, ask him if we could still contract with Dr. Espaillo, and then we would hire our own nurses under his direction and under the county. Is that the way that is that correct? Am I gathering that correctly? Chad, go ahead.
Yeah, essentially, I don't think you even need that doctor. Ideally, it'd be great if you had someone to back up, but I'm saying and this is just talking off the cuff, right, is we'd have 2 RNs or a nurse practitioner and then 2 RNs, and we'd have 3 CNAs or whatever the team needs to be. So we'd have the licensed professional medical staff in-house, plus, like I said, 2 or 3 or 4 assistants running around. And that's how once they're under your control, then you can mobilize them as you see fit. Right now, I think the big struggle I'm hearing is they're sort of there randomly throughout the day. Sometimes they're deployed, sometimes they're sick, and we never have the support we need. So you're winding up having COs passing meds out. These people would be under your purview as staffed employees. And I think, gosh, that'd give you a lot more control and ease of management. So I know it's a heavy lift to begin with, but in the end, if Fargo Cass Public Health isn't doing it, we do it ourselves, and I think we can do it better.
Okay. So then I think what we do then is go back to the drawing boards with Andy, Robert, myself, and Mary, and then see how we could potentially put something like that together and see what it will cost, and then maybe come back at another meeting and maybe have the cost of that, and then maybe some private ones. Is that kind of what we should do then, the direction? Go ahead, Commissioner Pollock.
Okay, thank you. You know, earlier I said it doesn't look like we're going to be happy to have Cass Public Health to continue, but we really have to use that as our first choice. And if all of a sudden their $600,000 turned into $800,000 or $900,000, they might look at this differently. Because right now, I believe for them, they're getting the money, but they're spending more than they're getting in order to provide the service that we need. And right now, their services and staff are stretched so far. But truly, the whole idea behind public health is the type of activity that we're asking them to provide for us. And you know, and if they want to focus all their resources on providing for the citizens or for the people who come into their facility, then we really have to rethink not only what we're giving them for this jail care, but also the contribution that we're giving to Cass Public Health as a commission on an annual basis. But I really do believe that everything that we're going to do has to start with Cass Public Health, and if we can't do it within there, you know, then we go the other direction. But if we're going to spend the money, let's just see if we can, spending the extra money with them can get us where we need to be.
Okay. Chad, Commissioner Peterson, did you have your hand was up again?
Yes, sir. What Commissioner Pollock said is outstanding. And one thing for point of reference, I actually called one of the directors of nursing at Sanford. Right now, with starting nurse salaries between $20 and $25 an hour, 10 years experience is between $30 and $35 an hour. So that would give us a baseline of where our pay needs to be. If we need to quote, if they can't find anybody, quote unquote, will we exceed that by $5? And when I explained to the person who I'd rather not point out because it's kind of an awkward thing to be talking to these people, when I pointed out their hours would be static, meaning you work these 40 hours and you've got the best benefits in the Midwest plus a pension, The person's statement to me was, we would have a line out the door of nurses wanting to work at the jail. We could not contain them. We would be outdoing the VA. So if we were to do what we want, if this is the way we want to go, finding people will not be an issue, not even kinda.
Okay. Robert, you got your hand up?
Yeah, thank you. And I think I think Sheriff Johnner and Captain Frobig and I have some pretty clear direction to follow up on. I would just simply tell the group that I think in 2 meetings with one with Fargo Cass Public Health Director Desi Fleming and well, both of them with Desi and with Assistant City Administrator Mike Redlinger. I think their message was very clear to us that they would prefer not to be in the business of jail medical, and if that spawns into some larger conversations, so be it. But I think they have been as clear as they can, trying to communicate their desire in the future in any involvement in this relationship. So again, I think we have direction of the number of things we're going to look at, but I believe they have been. I think they've made their position as clear as they can to us that have had those conversations.
Well, and I think based on what everyone was talking about, Robert, that we would just be looking to potentially contract with them and using Dr. Espejo, so there was some governance there, and then the county would hire the nurses, so they would fall under our employment, if I was correct and understand everything correct, and we would just be paying them to get guidance or be under the medical direction of Dr. Espejo, whatever they would charge us for that. Was that right with what I was gathering?
No, I think I interpreted the same thing, but I wanted to just make sure that I was sharing what I took away as their overall message.
Sure. Commissioner Sherling.
Thank you. So just so everyone is clear, and I believe this is correct, is that we contract for these 8 or 9 positions through Cass Public Health, but then if somebody's sick or they go on military leave or whatever, those positions aren't replaced by them. These are just, they're not actually positions that we contract for, they're actual people. So if that person is sick, we're out of luck. And that's not how I see a good contract being put together. If we were going to continue doing things with Fargo Cass Public Health, if we have a shift to fill, we have a shift to fill, and you know they've got their contract should address the fact that somebody needs to show up to take care of that shift. So I think this is a great direction, and you know, obviously it would be a heavy lift in the beginning, but I think in the end it could be a really good thing, especially if you compare, you know, if you're talking $2.5 million for a private company to do this, you know, we could certainly keep that money in town and I think do a better job. And you know, if we can't get a medical director through public health, you know, certainly there are other medical facilities in the community that we could check out, and you know, they all already have all of their medical records in place, and you know, I'm sure that could be part of the deal.
Andy, you had your hand up.
You're muted.
Sorry, I actually turned it off instead of on. I just wanted to kind of bring off of what Commissioner Sherling had to say there, in that, you know, when we come back with this, just a couple things to prelude with. One is that, you know, if we were to make it attractive enough and I'd be perfectly happy with all the current nurses just switching over to be employees of ours. That's no problem. I mean, I'd keep them all. It's not a matter of how they perform. But we'd still be in the same position if we just hire what we currently have and put them under our umbrella, in that they're still going to be deployed, they're still going to be sick, and we'd have the same problem we have with correctional officers, in that when there's a vacancy, there's just a vacancy. And do they fill it with overtime or does it just go absent? So we're still going to have the number issue that we have to deal with, regardless of who's paying them or managing them. The other thing that there's going to be a substantial cost with going away from what we currently have is with the implementation and finding a new electronic medical record system. When we implemented, it was a substantial cost, which I believe was in the hundreds of thousands of dollars to build an independent one, contract for one of the buy one. We had reached out to Stanford to see if we could get enrolled as like a clinic under their system, and we couldn't even get them to call us back. They just weren't interested in doing that. And it was through public health EMR system that we were able to integrate, and basically it's just management fees. We don't have to pay any kind of licensing or anything for it. So that's just another added cost that we'll have to have on top of all these other things that we'll need to integrate it and implement a solution. So we should probably get IT on board with researching that as well, if that's the path we're going down to trying to manage this ourselves.
Okay. Well, I think we got to go back to the boards a little bit here. Robert, Andy, and I, and we've got your guys' direction now to at least explore that. I think we do that, and then we also, since we've already started the process, just maybe get some additional estimates from these private companies so that we at least have all of it, so that the next time that we talk, we can give you the specific numbers. So I think that we go from there and see what we come up with.
So, Sheriff, did you have anything else you wanted to cover?
I do. I have a couple other things I just wanted to mention to you, if I could. Is there any other questions on this at all? Okay, a couple other things that I wanted to cover then real quick with, we just got a few minutes left here, is the first thing is you guys saw the governor's order that came out in reference to the mask mandate and the occupancy in establishments. Both of those items were addressed. There's been some, I've been on the media 2 times today, and I'm going on there right after this meeting again. There was some sheriffs out west who said that they weren't gonna abide by the governor's order, and that's what I've been getting asked about today. But I just simply wanted to let you know what ours was, since you're commissioners and the public might ask you. If you don't have Facebook, this is what we sent out as a message to the public. I'll read it to you here real quick. It just says, on November 13, 2020, Governor Doug Burgum signed into effect Executive Order 2020-43, which implemented a mask mandate and occupancy capacities in North Dakota. The governor's order is attached. The Cass County Sheriff's Office typically takes an education-first stance when new laws and rules are put into place in Cass County, North Dakota, to ensure our citizens understand the law changes. We will take the same approach to the governor's orders because it is slightly different from those ordered in the past during this pandemic. If the Cass County Sheriff's Office is called to a violation of the order, we will provide education and assist in working through the situation in the best order of public safety. Our mission is to work with our citizens to ensure public safety, and in doing so, using common sense and discretion. The Cass County Sheriff's Office thanks our citizens in advance for abiding by the order and keeping the public safety in mind. The Cass County Sheriff's Office does not expect to have any issues with the governor's orders, as our citizens have been mainly accommodating to his past orders. So that's the stance that our office will take. It's not different than any other stance that we take when there's new laws, ordinances put into place. We always do education first because we feel that's important, number one, to build dialect with citizens that we serve, and to just make sure that they understand the laws. And so if we're called to something where someone reports a violation of the governor's order, our intention is to go there and investigate the incident so we fully understand all the information involved with the situation. And then we'll provide education to that person. And the only time that I really foresee us citing the infraction would be if we have egregious, much like the governor stated, egregious activity. And I've been asked about that. Well, what constitutes that? To me, that's someone hosting a party in a public setting, not on their private property, in a public setting, because on private property we might not be able to access that anyways without a search warrant. and this is an infraction, so I don't even know if we'd be able to obtain a search warrant to get onto the property. But in this particular instance, if someone rented a public building and they held a dance, for example, and the capacity of that building was 200 people and they had 1,000 in there, and no one was wearing a mask, that's egregious to me, and we would need to maybe handle that differently than maybe, I mean, obviously we provide education still, but we might have to handle that one a little bit differently than other situations. Of course, if we have a private property situation, that's strictly up to the business owner. If the business owner doesn't want someone in their business because they're not wearing a mask, that's really not up to us in that particular situation. They would call us and we would go there and ask that person to leave their property if the property owner wanted them to be removed. But that's certainly up to the property owner at that point. I'm not going to have our staff out driving around actively looking for these things, mostly because I don't have the staff to do it. We're really busy right now with things going on in the jail, with the calls for service that we're taking and other issues that we're dealing with. So we have to use our resources a little bit differently than just driving around and looking for violations. So that's the stance that we've taken here at the Sheriff's Office. Certainly, public safety is kept at a high priority during this time, and we don't want people to get further sick from this. So we'll certainly look into every incident that we get called to and address it in a common sense manner. So that was one thing that I wanted to bring up. Does anyone have any questions on that at all? Okay. And then I want to throw this out on everyone's radar. Certainly, I don't think we're going to do this in 2021, but I would like to have us be thinking about these things, because I think that they're items that could be a little bit more substantial costs, and so I would like us to be thinking about them, maybe plan for them. And that is, obviously, I still think that we need the jail intake expansion to happen at some point. I think that obviously West Fargo has been growing. The community is getting bigger, the population is getting more, and I think that adding that piece onto the jail really helps us. It really makes us more effective, efficient, and so I still would like us to keep that on the radar. I know that we maybe necessarily didn't get all the CARES funding that we needed to potentially do that this time, but I don't know how we plan for that, or if we can set money aside here and there. But I think it's something that we'll definitely need in the future. And then the other one is the building, which kind of falls more under Robert and buildings and grounds, and that simply is the fact that we have a number of pieces of equipment now that are out at the county road department in Jason's building. Jason and the county road department staff has been really accommodating to us, and they've been very helpful in letting us allow us to put our equipment out there. But we take up a substantial piece of their building with our equipment. In addition to that, our equipment gets dirty out there, and it has an effect on the operation of the equipment, and sometimes the batteries being dead and things like that. And we have staff that goes out there and checks on those things on somewhat of a regular basis, but it's not as efficient as the building if we had it here on our own property, where we could have someone run back there every few days and check on it. In talking with Gene and Robert, Gene seems to think that putting a building up here to house those pieces of equipment in would not be all that expensive. It's certainly not, I'm not brushing it off as it's cheap. But he thinks that because we already have a building out back and there's a drain in there tied into it, they could easily tie into that and be a matter of just putting up a structure. We don't need anything elaborate. I'd like to have running water in there so we could wash and maintain our equipment in a drain and some heat. But other than that, it would be a basic building. And so I'd like to just throw that on the radar for the future. I think Jason would definitely be in accordance with me in wanting to get our equipment out so they have more room. So I think it benefits the road department as well. And so I just want to throw those things on the radar. And then lastly, we have put together an emergency situation for our field staff and our jail staff, a contingency plan, because we have a number of people out now that are being quarantined because they have secondary exposures from their house. and people that live in their house with them that may have COVID. That's really cut into or really strained our staff that we have available to work at the jail. And much like I started this meeting out with, we have a number of people out there, between 8 to 10 people that are working an extreme amount of hours. Some of them are fine doing it because they like to make the extra money. But when I say extreme amount of hours, I'm talking 240 to 280 hours a month. And like I'd mentioned, one person that had worked up to 312 hours. I feel like those individuals not being able to have days off eventually are going to say, hey, I can't do this job anymore. I need to have some days off here and there. And so we've looked at how we could try to rectify that a little bit, because we're really at the mercy of these quarantine tests. So we've looked at putting together an emergency plan to bring in our field staff to assist in the jail and try to give some relief. And of course, that pulls resources from patrol and investigations and civil process. And so we're currently working on a plan to do that, to try to give some of these individuals some time off and things like that. So, but our overtime is it's okay right now. We're not over by any means. And certainly it's because you guys were gracious enough to give us extra overtime last year. But we've really been tapping into that. And of course, there's somewhat of a give and take there because we're not fully staffed, so we can pull some money out of there as a line item, I guess, if we need to in the end to make it work. But I just wanted you to be aware of those hours and how hard some of those individuals are working to keep the place open. And that I think was pretty much it. We have I'm going to need to get approval, I think, from you, Chad, as the chair. We have an individual who's leaving the sheriff's office, and we're going to reclassify her position to a lower position actually, and try to move someone in there. So you'll see that come across your desk for a change in a structure and a classification, but it's a lower one, not a higher one. And so other than that, Mary, do you have anything else from yours and my discussion on any of these things, or Robert, because I've been running these things by you?
Just a quick question for you. Are you seeing turnaround times on those tests getting quicker?
Not quite yet, but we just started implementing that saliva one last week. So I think it'll take a couple weeks to gauge that.
Okay, because I'm aware of a couple of people that went over to Moorhead and they got their results less than 2 days.
Yep, that's what we're doing. We're sending people over there now, and then we're still using Cass Public Health, but a little bit, only in certain situations where it fits what we're doing a little better. So. Okay,
and Commissioner Pollack, did you have something?
Yes, I'd like to remind the sheriff, or maybe he's not aware of this, but the building that you call Jason's building at the highway department actually is what I've referred to as a public services building. The reason why the commission funded that was so that we had a place where we could manufacture the sandbags during the flood crisis. And so if that space can work for you as it is, I mean, it's not like it's the road department's heated shop, because you guys all have needs and all have uses for it. The number one exposure that this county has, the biggest risk that we have is having a massive COVID outbreak in the jail. And I think that the sheriff's department you should start operating under your emergency contingency plan now in anticipation of having that breakout, because you just don't have the ability to isolate the new incoming people. And whatever your plan is for when that breakout occurs, I think you should be operating that way now to try to prevent that outbreak from occurring.
Commissioner Pollack, I appreciate your comments, and that's what we're looking to do. We're looking to make the jump to do that now, so we can get some people relief and do that thing. And then just to refer to the building, like you were saying, I just want to make sure that I didn't come off as saying that Jason wanted us to be out of there by any means. They've been very accommodating, and we appreciate the relationship that we have with them. It really is probably coming more to the fact that we're running out of room out there. There's a piece of equipment out there that takes up a substantial room, and it's called the Rook, and it's a piece of equipment that belongs to Red River Valley SWAT. It's actually a semi with a long flatbed trailer with a skid steer on it. The Rook is an actual up-armored skid steer that SWAT uses. We've agreed to house that out there because, as you know, Red River Valley SWAT encompasses Clay County, Cass County, Fargo PD, Moorhead PD, and West Fargo PD. And Fargo PD is currently paying for the SWAT building where we have our other 2 SWAT vehicles, our negotiator vehicle and the bomb vehicle, and they pay for that building. The city of Fargo does just out of, just to help out with it. And when they got this new piece of equipment, they said, hey, is there any way that the county could help with this a little bit? Because Fargo is providing the structures for all these other vehicles. And at the time, I talked with Jason, and Jason said, yeah, we could do that. And now we're to the point of where it's just kind of, it's getting tight out there. I think what I'll do is I'll have maybe Mary and Chad and Robert come out there with me one day and just kind of look at it and see what they think for how we should proceed. But I just wanted to make sure that I mentioned to you that Jason was not by any means wanting us to leave. He just said that it would be nice to have a little extra space for their stuff as well. So.
Okay. I think you need the new area at the jail much more than you need the extra shop space.
Yeah, and I just simply wanted to throw these things on the radar. I know it's something we can't do tomorrow or next year. I just wanted us to be thinking that maybe in the future, if there's a way to maybe set something aside to make it a little bit more economical or something.
Sure. Thank you, Sheriff.
Yep.
Okay. Well, we've got a highway department a minute ago. So is there anything else quickly?
Nope, that's all I had. Thank you.
All right. Thank you all. See you in a sec.
Thank you.
Everybody.